You want answers?
I'm as mad as hell, and I'm not going to take this anymore.
You want answers?
You have offended my family.
I think I'm entitled. You want answers? I want the truth.
And you have offended a Shaolin temple.
You can't handle the truth.
Surely you can't be serious.
I am serious. And don't call me Shirley.
Radical Rant.
Well, it's that time again where the ONDCP and the DEA need to justify their existence, and so the Office of National Drug Control Policy's drug strategy for 2013 has just been released, and it's so pretty. They give you all sorts of interesting. I'll give you a look at the website here. This is the website, and you can see, we have a judge who's hugging a man who's obviously, must be a drug user who's been helped with a drug court somehow. What a great policy we have to help these people out, right? So that's the way they're going to sell it to you folks. And, my job here is to poke holes in it. Although I do have to admit, there are a couple of things that we can point to in President Obama's drug control strategy that are positives. So it's not all doom and gloom here. So listen closely. There might be some surprises. First of all, I want to address some points that are made on the ONDCP's announcement for this on that page I was just looking at. And just a couple of stats they throw at you, as if, these things are, truth. In 2007 alone, illicit drug use cost our nation more than $193 billion in lost productivity, health care, and criminal justice costs. All right, so let's think about that for just a moment here. The criminal justice costs, a lot of those have to do with the fact that we criminalize people who use drugs. So you can't be dropping the cost of your own policy into the discussion of why we should continue your own policy. That's your fault. Productivity and healthcare. Well, let's talk about the productivity one. This is a nice slippery stat they like to throw at you. And how they come up with these numbers for productivity, folks, is they take a look at the lifetime income, lifetime earnings of people who do not use marijuana versus the lifetime income and earnings of people who do use marijuana. Well, surprise! Pot users generally make less money. Why? Because we get P-tested for all the best jobs. Because we get discriminated against in hiring. Has nothing to do with our ability. It has everything to do with having to take underemployment or different employment in order to survive and to forego the full opportunity of income that would be available to us if we weren't discriminated against. I'm sure if you went back to 1930s and looked at the stats there, as far as how well Irish people were doing, it might be lower as well. Has nothing to do with being Irish. Has a lot to do with discrimination. Has a lot to do with which jobs for which they could apply. And this healthcare issue. The illicit drug use cost our nation all this money because of the healthcare issues. We all know that we're talking illicit drug use. We're mostly talking about marijuana use. And if you want to reduce healthcare costs, give people a chance to treat themselves with cannabis medicine instead of spending all that money on the healthcare for all those other pharmaceutical drugs. We'll come back to those in a moment. Another statement they make in the opening, nationwide, drug-induced overdose deaths now surpass homicides and car crashes as the leading cause of injury death in America. Now, this is one of those distractions where if you don't realize that homicides and car crashes have declined drastically, it sounds like a big deal. Car crashes have declined a great deal. We've made our roads safer. We've made our cars safer. So the deaths in car crashes have gone down. Homicides have also gone down. But let me give you this little chart that will show you those drug-induced deaths. This is a chart of all the drug-induced overdose deaths in America from 1999 to 2010. And you can see that they've roughly doubled. And that doubling is almost completely fueled by unintentional self-harm from pharmaceuticals, otherwise known as people taking pharmaceutical medications advertised on their TV, ask your doctor about Damitol, and accidentally dying from them. This little tiny line you see at the top, that's your deaths from cannabis, mescaline, LSD, opium, mushrooms combined. It's a line compared to the huge green swath of pharmaceutical deaths and the nice blue streak of alcohol deaths and the strong purple tinge of cocaine deaths and the red from heroin and the orange from narcotics and the yellow from psychostimulants. And cannabis can't hardly even be seen on this chart. Now, part of the Obama strategy here is built primarily on the rhetoric of Kevin Sabet, who I have studied intensely for the past year. And they always want to point back to the science. They want to seem to be the ones that are promoting a scientific, well-researched, logical, neutral sort of tone here. And the statement that comes from Gil Kurlikowski that's so offensive: drug policy reform should be rooted in neuroscience, not political science. It should be a public health issue, not just a criminal justice issue. That's what a 21st century approach to drug policy looks like. No, you should be taking the word just out of there. It should be a public health issue, not a criminal justice issue. You put one too many words in that statement. And as far as drug policy reform being rooted in neuroscience, not political science, it is the political doctrine, it is the actual regulation that defines Gil Kurlikowski's job that prevents him from placing drug policy reform into neuroscience and basing it on neuroscience. The Office of National Drug Control Policy sets that the director, that would be you, Gil, must oppose any attempt to legalize for any purpose any drug that is in the Schedule 1. And we all know that means marijuana. You are required by the very definition of your job to root your drug policy reform in political science. As we continue, it gets into a section that they call Drug Policy 101. And I'll just read the paragraph to you because Kevin Sabet probably wrote it. While law enforcement will always play a vital role in protecting our communities from drug-related crime and violence, hold on, let's stop at that comma. This assumes that for the rest of American drug policy, law enforcement will always play a vital role. We have no intention on never treating you like citizens who use drugs, and some of you might have a medical condition. You will always be treated as criminals. And protecting our communities from drug-related crime and violence, what is it that creates the drug-related crime and violence? While you're thinking about that, try and remember how many shootouts you've seen lately between Corona and Dos Equis and get back to me. After the comma, they say, offensively enough, we simply cannot incarcerate our way out of the drug problem. I couldn't agree more, so knock it off. Stop incarcerating people. Put simply, an enforcement-centric war on drugs approach to drug policy is counterproductive, inefficient, and costly. Great! So stop it! At the other extreme, drug legalization also runs counter to a public health and safety approach to drug policy. Really? So where's that part in here that bans alcohol and tobacco? We wouldn't want to have a public health and safety approach to alcohol and tobacco that treats it different than drugs, would we? Oh, right. Alcohol and tobacco are strong cultural things that people have used for millennium, and for some reason that makes the most dangerous and addictive and toxic drugs okay. All right. It continues. The more Americans use drugs, the higher the health, safety, productivity, and criminal justice costs we all have to bear. Well, again, you can't lump the criminal justice costs in. That's your policy. Health, safety, and productivity, our workplaces have never been safer. Our roadways have never been safer. Crime is at its lowest levels ever, and the American workers are producing more goods and wealth per hour of work than ever measured. Health, safety, productivity are the best they've ever been. Looking for a solution to a problem that doesn't exist. Now, they continue in this Drug Policy 101 to talk about how we're going to use rehab. We need treatment and rehab and prevention, right, to stop us from using drugs. They cannot accept that some adults will just like to use drugs. Some adults like to climb Mount Everest. Some adults like to jump out of planes with flying squirrel suits on and come within feet of the mountains that they are plunging past. Some people like to swim with sharks. Some people like to hunt elk, and some people like to drop acid. What harm from all of those groups could there be? And whatever it might be, let's find a way to mitigate it. We've seemed to have found a way to allow people to hurl their bodies out of planes when, they could fall on people, they could land in places, but we've found places for them to do it and ways for them to train and people they can register and rules they can follow, and we'll let people hurl their bodies out of planes for a rush. We can't accept that for marijuana, huh? All right, let me get to one point. I did want to make some points that are definitely need to be covered here. Supporting programs like screening, brief intervention, and referral to treatment, we can promote healthy lifestyles, prevent addictive disorders from taking hold, and reduce the number of people entering the criminal justice system. What this means is they want to start getting the doctors, your regular family doctors, to start evaluating whether you got a drug problem, and if you do, off to rehab you go. Today, about 22 million, and then they followed up with this, amazingly enough. Today, about 22 million Americans need treatment for a substance abuse disorder, yet only 2 million, about 1 in 10, actually receive the treatment they need. Well, gosh, maybe if you weren't screening, briefly intervening, and referring us pot smokers to treatment, there'd be some beds there for the meth addicts and the alcoholics. But let's close with a little bit of good news. There is something good in Obama's policies here. Through the Affordable Care Act, otherwise known as Obamacare by some people, insurance companies will be required to cover treatment for addiction just as they would cover any other chronic disease. And as a son of an alcoholic who had to find a way to pay for inpatient detox and 30-day recovery in a hospital situation, and back in the late 70s when the insurance companies wouldn't do that kind of stuff, I will give you credit for that. Let's have people who actually have a problem and actually need treatment. Let's find a way to fund that. I'm with you there. So maybe there's some room for us to learn from each other. Hour 2, we're going to tell you how everything you tried in 2013, you tried in 2010, and it didn't work then either. For Brian the Rat, I'm Radical Russ. Thanks for joining us, and until next time, take care of each other, tokers.
This is the Russ Belville Show. The Russ Belville Show is blogging and podcasting daily at radicalruss.com.
You plant it, you grow it, you dry it, you roll it, you smoke it. You take a seed, you plant it,